A warm, cheerful welcome to all with a great smile today. I am Dr. S.Sezhian, an oral maxillofacial surgeon who's practicing in Hyderabad right now. Today's topic is about special care dentistry. So everybody has their own pain, depression, everything happens around us very quickly, very fast. So the best medicine for us to start off with is laughter is the best medicine to whatever it is. So mentally, physically, whatever you're hurt also, this is the best medicine. So once you see all these pictures, though they are from different groups, the characters around the slide, you see them, you get a smile unknowingly inside yourself. Not only them, it's also us. Okay. So in order to make this smile a little more better and more precise and wonderful, we need a wonderful structure within our oral cavity called as tooth. So let me start with this and basic brush up about quick one, anatomy of tooth structure. So this is the tooth structure, which is the first layer enamel, the second layer dentine, and the innermost layer, which is called the pulp. The pulp has its own nerves and blood vessels. Each and every tooth has its own nerve and blood vessels. That's why each and every tooth is very sensitive. It's most important to us. To be very simple and frankly to say, the longer we have the tooth and dentition within ourselves, the better and the long life we can live on. I'll tell you about the general oral health and hygiene. These are the common doubts or questions within our minds, which is always erupting. When is the actual chronological age of the first tooth to be erupted? How many tooth total number are there? Then, if it is a milk tooth, is it a deciduous tooth, or the milk tooth, or is it the permanent tooth which serves us for the remaining rest of our life? And next one is how to reduce the cavity formation and the reasons for cavity formation to decay. So, this thing, the common dental problem. The common dental problem is a tooth decay. When it comes to a tooth decay, the most ultimate reason which is responsible is your microorganisms, which is the flora, the bacteria, and the microorganism, which is present in your mouth because of improper oral hygiene, which is already there. And moreover, kids, ourselves, and today's generation, we mostly eat a lot of sugar-contained diet, carbohydrate diet, sugar-contained diet, most fatty diet, and every so. So that will form an acid in your oral environment. This oral environment, which is completely more of a pH acid, that will hit on the healthy tooth, which will cause a tooth decay. Now, the stages of the tooth decay depends on the first 2, 3, 4, 5, and 6 stages. So, as I told you earlier, the layer of the tooth, first layer is the enamel. So, the stage 1 is where you find the white spots. The white spots happen so that your tooth, which is already the enamel, which is white and ceramic polish kind of structure, becomes more white, where it is hypermineralized, which is like this. We have a normal range of every value and parameters in the body. If it's too exceeding, it is abnormal. If it is too depressing or even below the normal levels, it's very harmful for us. In the same way, the hypermineralization causes the whitish, that is a white opaque structure or spots, where it shows the first sign of indication for your tooth decay. Next stage comes the enamel decay, stage 2. Stage 3 is the dentine decay. In the enamel decay, people usually find okay, I have a cavity in my mouth, please, what to do, doctor, or something like that. But they may or may not feel a sensitivity in that stage. In the stage 3, where the dentine is exposed or the touch, this is the most sensitive region in our tooth structure, in the tooth layer. So there causes and arises the issue of sensitivity, constant sensitivity. The next stage 4 goes to the innermost layer, which is involving the pulp. This pulp, which has the nerve endings and the vessels, this will cause a lot of pain. This is where the intensity of the pain really abrupts you to the rocket style shooting rocket level, where this intensity of pain will transform into a stage 5. In between the stage 4 and stage 5, what happens is that the kind of infection which happens or arises will increase and it subsides. So some certain stage where the patients or they come to our clinic, they'll say like, yeah, I had earlier sensitivity, then a pain, then later it subsided. Now again, it started abruptly. So what to do about it? So once we take out or once you visit a dental clinic, they will take an X-ray and see whether there's a root infection. This is where the roots are visible that we can tell you about whether there is an abscess formation, cyst formation, or any other periodontal, that is the structure that surrounds the tooth structure is infected or not. This kind of inflammation around the tooth structure is called the periodontitis, where your bone which is supporting your tooth structure becomes inflamed, and then therefore even a good looking tooth, because of an improper hygiene, a gum inflammation or a gum bleeding, even a good looking tooth at sometimes because of the hidden infection inside the root level will cause the root to mobilize, or it can even exfoliate automatically. It starts becoming mobile. So once it starts becoming mobile, then later the stage 6 happens where you ultimately have to go for a tooth loss. So in these stages, from stage 1 till stage 5 to the maximum, or maybe stage 4 more precisely, you can have the options to save the tooth by various dental procedures. For example, the first thing the treatment starts from cleaning, scaling, what we call it as, and next is filling, where the superficial layer is filled up and patched up. Then it comes for the major loss of tooth structure or the sensitivity. We go for capping of the tooth. We go for root canal of the tooth. Please do remember, root canal treated tooth are becoming very, very brittle, so that it is always advisable to place a crown over the tooth structure to preserve the tooth structure for a further long time. Next, the chronological age of the tooth eruption for the kids, especially. So basically, how many of us really spontaneously know that how these many number of tooth of deciduous teeth or the milk teeth for the children are there in oral mouth? So the number is 20. For the adults, it's 32 teeth. Mostly, if all your wisdom, last 4 wisdom tooth, 2 in the upper, 2 in the lower, gets erupted. So generally, it will be 28, and maximum it will be 32. Most of the wisdom tooths are always problematic. Though the wisdom tooth were actually useful for our ancestors and the pre-generations, right now we have evolved so much. The food, the dietary, the lifestyle, everything has changed so much. The jaw, the length and width, the dimension of your whole jaw and the face is so much evolved that it has become so small, it's not able to accommodate the last third wisdom one. So please, whoever it is, so at this stage where the wisdom tooth erupts, for example, from 18 to 23 years, I have personally even done a surgery for those people who are above 60 plus also to go ahead with the tooth removal on that later stage. But the very common thing is, at later stage, your bone gets very sclerosed, which is like very tight, and the tooth is very fused to the bone, which becomes difficult at that time for my patients to operate also, as well as for them to recover. It will take a little more time. So the sooner, the better. It is like in general medicine, it's like an appendectomy, where you just have to take it out, the vestigial part, where it is not useful at all, and then be peaceful at the rest of your life, attaining your wisdom. Next. So, what is special care dentistry? The special care dentistry is a branch of dentistry where we deal with physical challenged, mentally compromised patients, developmental anomalies, cognitive or intellectual challenged children with autism, with CP, that is cerebral palsy, or mental retarded children, or even sensory issues, which is like in disabilities like visual loss, blindness, hearing loss, and hearing impairment, and syndromes like Downs, etc. So this special care dentistry provides services to all those people who are specially challenged. Okay. Next, it will also help you to evaluate the process, assessing the patient's level of cooperation, treatment planning, management techniques, and sedation if the treatment is required or not. if the sedation, you see, basically the thing is like not all special children are uncooperative. Most of them are cooperative. They are almost like a normal individual. They are nowhere to be hindered in or stopped in carrying on with their normal oral hygiene care. Okay, so even they have kind of sensation, they have feelings, they have pain, they have bleeding in their gums. They have a lot and lot of issues which will go through the rest of the slides. So the sedation treatment that is written over here is only based on those extreme cases where it is not cooperative or it's very unable to kind of stabilize them in one position. So we will take a decision on how to go with the sedation, whether the need of local anesthesia or a general anesthesia. General anesthesia can be mild, moderate, or even severe. Even that also will just have a touch points here and there in this kind of presentation. Before visiting a dentist, what you need as a normal individual, as well as especially for a special child, parents, or caretakers who are there. It is a teamwork. It is an interdisciplinary approach where three ideal people, that is the patient, the dentist, as well as the parents or the caretakers, are definitely involved into the picture. Without this kind of communication, the transparency of communication, the trust between these three people, nothing will work in the sense like the treatment that will take over will have to be smooth and harmonious. It should not be disturbed in any manner. And we should really take care because we're dealing with a special child. The first visit is always a short and a friendly one. There should be a multiple visit in the sense, like the first visit, not everybody will cooperate. Even a normal individual will not cooperate. Once you go to the dentist, it's very difficult to convince each and every patient for their problem. You should try to explain what is the situation and then later show them the pictures, what is the stage of condition, the treatment, planning, everything. Then only they get convinced and then we can go ahead with the treatment. But for a special child, it is always that, we should be taking them in a clear question, short phrases to gain their confidence, call them by their name, have an eye-to-eye contact. I know certain special children will not have an eye contact, but please call them by name, make them to gain confidence. Some children may not feel, they will feel a very sensitive to touch also by a stranger, but at the same time, take your, please ask your caretakers, the parents of the child, or even the dental assistants in your clinic. So please ask them to be very, very, very gentle on them, very smooth on them, no raising voices. It is a very patient approach. This is one thing. In the first visit, though it is very short and quick, you can introduce yourself. You can show yourself that I'm the dentist. The parents and the caretakers, before coming or stepping into the clinic, you can show them where are we going and what are we going to do, who are we going to visit, in either a pictorial form, in picture cards, or introduce them that this is the person called as a dentist who's going to open your mouth and then check your teeth, like that. So little by little, in a convenient way, where the parent and the caretaker knows the way of communication to the child, so the child can understand properly, and he can come, step into our clinic, we can introduce ourselves, and from then we can take over the child's treatment history, planning, everything, examination, that. So the act of awareness, maybe due to anxiety or social interaction, actually delays or tampers these special child's dental treatment. You should not actually ignore this oral condition or a oral hygiene, like, okay, fine, he has a bad smell, he has a drooling complaint, he's not able to brush his teeth properly, it's okay, fine, no. Or maybe, what will the society think if I take my child out? No, never. Don't take it and look it as a barrier in yourself. You should step out for your child. You should step out for your children. They are also like us. So we should try to take up the decision of going and visiting to a dentist for his or her better future. Next, oral manifestation, if left is or ignored, will lead to severe jeopardy of the child's overall health status. It's all interrelated. It's all interconnected. The only only opening that actually invites any entry to from the environmental to your body is your oral mouth, and of course your nose. But the thing is, the oral mouth, the oral cavity, is actually where your food is plain, chewed, and then later it is brought into it. Only if this cavity, if this opening is clean, whatever goes in will be clean and hygienically it will be no, brought up. Sorry. So the supervision is always a must. Whether let it be brushing, whether it could be oral hygiene maintenance, whether it could be easy examination or the smile supervision, or whatever they do, they really need our help in the special children, especially. So a supervision of your oral hygiene and always an eye on your oral hygiene is some must. An individual oral hygiene program, the special care dentistry deals with an individual oral hygiene program where the planning can be done by the dentist and given to the concerned person in charge to explain and make the child understand, or the caretaker, make them communicate to the child to whom, why, and what is the procedure, to whom are we going to, why are we going to go there to the dental clinic, what is the procedure that is going to be performed. All this can be explained to them pictorially itself with picture cards. That will really help them. In certain studies, they have shown that showing the pictures, showing the models, and even role play or something like video modeling also helps for the certain kind of children to understand and cope up and cooperate. To the maximum, all the special children will cooperate. It's not that they cannot, and everybody is kind of hyperactive. It all varies from different to different individuals. Next, once you step into a dental clinic or if your child has a dental problem, who should we go first? Let me say, there are 8 branches of specialty in dentistry where your child should go to this special dentist, which is called as a pedodontist. Only the pedodontist is the dentist who deals with the pediatric dentistry, who deals with the children's child's mouth. So these are, for example, some kind of pictures like a pictorial card. You can cut them out. You can make an individual pamphlet like cards, picture cards, and then show the child like this is what you call an instrument or mouth mirror. This is a mouthwash. This is a toothbrush. This is a floss. A doctor is going to wear a glove. This is a dental chair. This is the instrument. This is like a needle, like a instrument which is over here. That will actually help you to kind of blow air into it like a spray and like the air pressure, all these things, something like air, like blow and show, like that kind of stuff. Because this is a multidisciplinary approach. Of course, you will be dealing with all this kind of OT specialists, speech therapists, and everybody. I definitely know that. But as a dentist point of view, I always tell my colleagues also to be prepared on how to handle the special child. Next, the common problems in children with special needs is that there is delayed eruption of teeth, there will be poor oral hygiene because of lack of awareness, and dental caries because of lot of food lodgement, food, sugary diet, medications. Because of medications also it can happen. A lot of pH can increase with the medications. Diet will be less. So we need to balance this to reduce the kind of ill effects of becoming a tooth decay. Next thing is a periapical infection or a cyst, because the immunity, that is like certain medications where patients are taking, will have a less immune. They will have a suppressed immunity in them. Then the tooth anomaly, there will be different types because of the delay in eruption. There can be different shapes of tooth. There can be multiple missing tooth. There can be multiple missing tooth which is buried inside your jaw itself. So all these are the chances. And of course, when the special child is happening, they will definitely have the physical appearance of most commonly a narrow upper and a narrow lower jaw, which is also a common problem for the common man. Where I told you regarding the wisdom tooth, you do not have any sufficient space for the wisdom tooth to come out. So ultimately, you have to go. The same kind of importance and attention should be given to the special needs when they are having a lot of problem, multiple problem, more than a common person. So you have to give an importance to them, saying that, okay, fine, now from when we can start visiting the dentist. I suggest like from the very beginning, once you start introducing the child to the dentist from as a like a family doctor, he or she, once they also grow up, they will try to adapt themselves and behave properly, and they will cooperate to the dental treatment with full trust, So basically, this upper arch and the lower arch can be narrow, and because of this, there will be tongue thrusting habit where your tongue will go and touch your upper lip, and it will start pushing your anterior, that is your front tooth. It will start pushing it because when it is narrow, your tongue doesn't have a space, so it becomes a macroglossia. The next sign. So the macroglossia is where it's kind of an enlarged tongue. So when they speak, also it kind of matters. It kind of a different phonation, pronunciations, all these things differs. So we feel like, oh, maybe he has a speech defect. No, it could be because of the dental and the orofacial dental bone defects also. It is not only the tongue. So speech therapists are well versed with training them for their pronunciation, how to give a orosensory, oromotor kind of reflexes for their pronunciation, for their phonations, for swallowing, for spitting out, all to basically activate your muscles around your mouth. This is the thing. And of course, the most rare, but it is dealt with in the category of special needs is the cleft lip and cleft palate. Cleft lip and cleft palate is a vast topic where it involves mostly like a kind of stage of surgery. We deal with a lot of multiple stage of surgeries to deal with cleft lip and cleft palate with the chronological view. Next, how these kind of symptoms indirectly affects the functions in specialty. It can, of course, the tongue, because of the tongue inflammation, speech is affected. Because of the tongue and the narrow jaw, drooling is happening there. Because of drugs, because of a lot of medications when the child are having, it causes dryness in the mouth, which is called as xerostomia. Then tooth fracture. Tooth fractures, I'll come to the topic. It's one of the common. It is one of the common problems where the special children are often exposed to this kind of physical abuse also. It can lead to fracture of tooth, it can lead to fracture of jaw, it can lead to dentoalveolar fractures where a segment of the jaw or the segment of the tooth can also come out. Next. So when you go to a dentist, what technique do they follow, or what technique you also should be aware of is this tell, show, do technique, where the parent or the caretaker, even the dentist, can guide you through a phone, like how you can kind of introduce the environment before you step into us with your child, which is you tell them, you show them picture cards of all the materials if you can. Please show them that I'm the dentist, like a dentist apron or a doctor with a cap and a mask, and then later the instrument. Or even certain dental clinics will provide you a kind of picture cards where you can, like flashcards, where they can give you, and then later they can tell you, like, please introduce these kind of terms to them, or introduce to them so that they can actually see. Then once they see, that is like once they tell and see the pictures, then later once they visit to the dentist clinic, then later you can show them these are the instruments. What is this? There is a card. There is a mirror. This is the mouth mirror, and then this is a probe or something like that. But kindly make sure that, of course, definitely the dentist will not give them any kind of sharp instrument in the initial visits or something to expose them at anyhow. But the thing is, like, they should be aware of all the instrument or whatever they are going to use. Whatever instrument that they have seen in the pictures, that they are confident, like, yes, I have seen it. That kind of atmosphere or a mentality should arise. And at the same time, the caretaker, the dental assistant, the dentist, or the caretaker or the parent will always be present around the child. This is the most important thing. Next thing is that not all the children will be advised to go on any dental treatment under general anesthesia. Why? Because there are many other kind of there are other kind of complications where the recovery complication can be there in the special children, because they are already having and taking medicines earlier. So all these things are actually very kind of challenging in general anesthesia. So next thing is that, as I told you, the general anesthesia, it can be based on the child, whether he or she is cooperating or not. It could be minimal, it could be moderate, it could be severe. Minimal can be, the general thing. It's called as a sedation dentistry, where you just tell the patient to inhale nitrous oxide, which is like a mask they'll place over the child. The caretaker or the parent should just keep it like that. And then later, once the child inhales, he will go into a subconscious state. So that is the minimal method, only by inhalation. Moderate is just by going through a kind of injection. That is a short-acting kind of sedation that will really help you. Next is severe. Severe is actually where you actually intubate. So even for intubation, we need to give a pre-anesthesia, which is an inhalation. Then we need to give an injection, and then later we will go for intubation. Intubation is where your anesthesia and the general OT theaters, that is the operational theaters, will get involved into that picture. Then in a dentistry, in a dental clinic, they will use a rubber dam. Rubber dam is a kind of a sheet. It's like a polythene sheet or maybe a rubber sheet where it will be fixed to a frame and then it will be fixed to the child's mouth. Not all child will be cooperated to this, but this rubber dam is a very good beneficial technique. Why? Because the rubber dam will give you 100% or to the maximum isolation because all the child who come to all the special children mostly who come to the dental clinic could have a drooling issue. We need, as a dentist, need a proper isolation for the treatment to succeed. And moreover, the child should not bite on any stuff, or maybe the dental instruments, which are very minute and thin, should not get aspirated into the child's mouth. All this can be saved by using a rubber dam technique in the dental clinic. Next, mouth probes. Mouth probes or bite blocks. They are materials which are kept in between the upper and the lower tooth so that your mouth can be kept in an open position. If the child is kind of having an involuntary movement of CP or maybe an epilepsy or maybe an uncooperative patient or something like that, then just for the safety purpose, some child, if the child is not at all cooperative or tends to go for an uncooperative kind of state, then later we can give them a safety belt of which is attached to the chair, and kind of physically challenged people, the wheelchair. All the dentist clinic or the kind of atmosphere will have a ramp so that the physically challenged people can easily go step into the dental clinic and transfer from the dental chair, and the wheelchair will be very easy. Then there is this thing called as a pedi wrap. Pedi wrap is nothing but you can take your hands like this and then just wrap it around, where some child will be like this, and then the child will be sitting on the parent's lap. So he knows that he's in the safe hands, but at the same time they don't want him to move. So the parents or the caretaker cannot kind of restrict, and maybe it actually supports them. That is what you call a pedi wrap. Then, if behavior management strategies and formation of sedation fail, only if it fails, then only the general anesthesia is recommended. And then there is another technique where this term, which is there, the pictorial presentations can help to form a structured visual guide and thus reduce the anxiety and goal of the treatment is achieved. So once you show the picture, once the child comes in, you show them the instrument, and they know that they are aware that I have seen something like this. Okay, fine. Now my mom is there, or dad is there, my caretaker is there. Nothing is going to happen to me. Then the child will sit down to cooperate. It may take time. Definitely, it will take time. But I'm definitely sure the special needs children are 100% cooperative, and to the maximum they will do that in the dental atmosphere. And video modeling for toothbrush. This study is also kind of conducted, which is very good to keep an oral hygiene for a special needs children. I will let you know about it. So these are the materials that is used for special care dentistry. This is Poposi's board, where the assistant and the dentist, they are trying to wrap up the child, and the child is already under the inhalation sedation, where it is a conscious dentistry, so that even if he is aware of it, he should not move. He should not move his limbs and disturb and shake, or even accidentally aspirate anything. So this is how they wrap them up, and then later the dentist is actually kind of operating the child over here. And to make the child or to make this special child, they may give them some kind of tactile sensation because some children will have a sensory issue. They will always want to have their favorite toy inside with them, or hug them, or maybe even touch and feel, and then make them feel like, okay, explore, like, okay, you do your work, I am busy doing something, something like that, to make them feel calm down. These are called as restraints. So it can be a point where the child can actually cooperate to you more. These are the certain techniques that can be used. Some children will be very sensitive to light, so you can give them some kind of blue shades, or maybe even the blindfold. But the thing is, like, certain kids will not be able to accept the complete closure of their eyes, but at least you can give them something like a goggle, colorful goggle, fancy glasses, where they will be very convenient and they will feel more excited about it. Then tips to maintain oral hygiene. The tips to maintain oral hygiene for anyone, for a normal or a common man or a special needs. This is actually, you must brush twice daily. I think this pressure really shows everyone that, every day morning the mother or the father will run behind the child and the child goes along hayway in the whole atmosphere, the whole house becomes a messy the half an hour in the morning. So basically, this kind of picture, the scenario is not just a picture, but it is an actual scenario that happens. And in special children, it is a little more challenging also, I think, to understand. But you should make sure that they are brushing twice a day. Rinse water after every food that neutralizes the acid that is produced by the microorganisms and the food that is present over there, and thus further reduces the chances of decay. Dentist, please visit the dentist before the age one. As I told you, the sooner the better, the earlier the better. The child will have a trust, he will try to gain, and then he will be more confident that my dentist or this uncle or an auntie is not going to harm me in any ways, and this is the best place that I come for my dental treatment. This is one. And moreover, the parents can restrict more of sugar diet, and children with special needs require a group therapy for stimulating the oral muscular activity that helps them child to spit the water after the meal and brushing and swallowing excess of saliva or food. This is all carried on and done by, I'm definitely sure, by OT and all the other therapists for, it's a group. You will all know it's a group kind of support that without one speciality, the child cannot complete one whole task. So as this is there, they will help you to guide how to massage your muscles and activate your oral muscles inside, outside, everything, so that there are simple certain techniques. For example, excess of salt in normal water, excess of neem oil in the water, excess of lemon in water. This is all will help them to kind of spit out. Like, they don't want the taste. They will try to spit it out. So once that meal, after the meal is over, try basically teach them to spit it out, which will help them to spit out even toothpaste during brushing. Next thing, swallowing. Swallowing, even in that, there is also a sense. So, this is a technique where your sensory sensations of your oral muscles should be enhanced. And then this kind of exercises or milking or even kneading exercise of your muscles will help them to swallow the saliva. How it is, because in a simple way that I have come across it, they will apply kind of honey or maybe any sugary kind of substance inside the lip area where the child tends to swallow. Once they tend to swallow, they can munch the food and then they can swallow. Those patients who cannot munch the food because of poor muscle tonicity, they are kind of improvements where once this kind of kneading technique or a muscle exercise technique, slowly the child knows to learn how much pressure to actually munch your food. And next, once you visit a dentist, he will definitely go for a dental examination. He will go for an X-ray, and then later, definitely, you will be doing yourself about the cleaning part. So once all this first thing, or maybe the cleaning part didn't work, then dental examination, then the dental X-ray, then the dentist will definitely say that the root scaling or the root planing should be necessary. That is, root planing or the scaling is basically maintaining a oral hygiene. That is the tooth cleaning. Next is flossing and polishing. This flossing and polishing can be done by your parents or the caretaker itself. Then the fluoride treatment or sealant. This also will be done in dental clinics where there will be a special tray which will be manufactured for, or maybe a customized tray which will be manufactured in the clinic according to the size of the jaw. And then the material will be put inside this tray. The material will be put inside this tray and kept inside the mouth. I'm talking about the normal person where they can be cooperative, or the child, even the special child, dyslexic or whatever, the LD child. Even that kind of children, they can just cooperate. It's basic about the cooperation. Just keep it aside, wait for about 2 to 5 minutes, and then take it out. Once you take it out, then later they will kind of polish it, the tooth structure, and then you will be fine with it. Next, the brushing technique. So, until the age of 6, use a thin pea-sized amount. So basically, we don't know how much amount of even toothpaste to take. So this is the most important thing. And moreover, for a special child, you must have a fluoride toothpaste, fluoridated toothpaste. The fluoridated, please look for a fluoridated toothpaste in your market or in a pharmacy. And these are the kind of requirement that is age that is required for a child's toothbrush. For age 1, it will be slight smear, and 3 to 5 will be a half of the pea size, and then 6 and above will be a C size. Because we really don't know how much of toothpaste to take. That is one thing. Next thing is, please make sure you are always guided. I mean, you always guide your child, even till 8 years, until 8 years also. Why? Because those children are always kind of playful. They may kind of brush. They may kind of keep their oral hygiene clean and improperly. So we always say that lack of awareness also leads to a lot of dental problems, right? So this has to be monitored. Once this is monitored, you will not be able to face any kind of pain in the future. These are some common fluoridated toothpaste where it will be definitely written. There are n number of commercial toothpaste, colorful toothpaste, tasty toothpaste, to whatever to promote and kind of fascinate the child. But please make sure that and talk to your dentist that you will definitely need, is there a need for a fluoride toothpaste? Because excess of fluoride, the fluoride which is there in your normal drinking water, it is there in your normal drinking water. But if certain areas differs, if there is an excess fluoride, then it can cause a hypermineralization. As I told you, it will cause white patches over your tooth, which can indirectly affect and kind of break down your tooth structure. So please make sure whether your child needs a fluoridated toothpaste or not. Special children may need a fluoridated toothpaste definitely. Why? Because their oral hygiene is a little compromised. Next, if the special children doesn't know how to grasp, this grasping ability is a big challenge for them. So you can modify the the toothbrush handles like this. You can make it extra long. You can make it like an alginate impression or a dough impression. You can stick a ball over there in the handle of this thing so that they are finding it comfortable to hold on to it. There is a curved kind of 45 degrees angulated toothbrush. There is a 360 degrees toothbrush. All these toothbrushes will lead, ultimately the goal is to keep your oral hygiene clean. And abroad, or many people will also recommend this kind of fancy kind of electrical electronic toothbrushes, which is also recommended for maintaining the oral hygiene. Then, toothbrush floss holders with with extended or wide handles is also recommended. This is what you call a dental prop, which will be used in your dental clinics. This is what you call kind of extended tongue depressor, which will be kept wrapped inside using a gauze or something, which will, or a rubber stopper, which will help your child to keep your mouth open. This is a kind of also a mouth gag or a mouth prop where it will keep your child's mouth open. Next, finally, when we come to this kind of model and a takeaway message, I would always like to let it be a dentist who's treating the child, or a common individual, or even a special children parent. I would like to tell them this: that each individual or each child must be treated as a person, that is like a basic human being with all due respect, and who is not defined or barred by any disability or a medical condition. And parents, please make sure, and the caretakers, please guide the parents. They must contact the nearby locality of hospital, the PHC, or a rehab center, or a multidisciplinary center in their town or in city to guide them for the nearest dental clinic for special needs. So please keep smiling and be safe. And this is one common thing that I found right now is that many people are finding, we are battling this COVID pandemic situation. So it all depends upon you, how you want to create your smile. Do you want to align it and make it smile even when you're hiding it behind your mask? Or you want to show it to be kind of defective itself? The ultimate message is we are one. There's no bar in between the special needs or a common person. So please keep smiling and spread the smile. And thank you so much, Fun Learning, and everybody of the participants who are here. And please take away the message and don't delay for your child's special care, or especially the oral dental hygiene. And please take care and be safe. Thank you so much.